Healthcare professionals, what subtle indicators suggest that a patient has a history of significant drug use? There is a 60-year-old man who had done some drugs in life, or was a heavy alcoholic. Never tells DRs of his past, quit all by age 50, health is falling apart by age 60. Drive does an MRI, and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. Drive shows him the extra space in his skull around his brain, explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. As a CNA, I noticed that all the patients with that kind of history often had muted, non-existent taste buds. They would put an excessive amount of sugar, salt, and other seasonings on their food drink because they couldn't really taste anything otherwise. Sometimes it resulted in weird combos like brown sugar in spaghetti meatballs or sweet sour sauce in strawberry yogurt. Well, I'm an ENT specialist and specifically specialize in rhinology, nasal, and sinus disorders. Septal perforation raises red flags, especially if it's super raw. I can actually tell if the user's active and if someone is lying about it. Also, I've seen the orange granules in the nose indicating someone has been snorting Adderall. I recognize it from my son's medicine. They know a little too much about dosing meds for their occupational and health history. There is no reason an accountant knows the dose increases of Oxy if they have no history of using it for health reasons. The person hasn't been a caregiver, no history of pain, yet they can practically write the prescription. Subtle. Drug smokers can have changes to their lungs on X-ray which are significantly more pronounced than cigarette smokers. I've seen heroin smoking patients in their early 30s have lungs of a 60-year-old 80-a-day smoking coal miner. When I asked them WTF was going on, they admitted their habit. Use the small, spindly one surrounded by other black and blown-out veins in the ut, so that they can continue to use the nice one for extracurriculars, until it starts looking like all the other ones. Re-saying is its way worse not to treat or to undertreat someone who is in pain, regardless of whether they are a drugs user, than it is to give a dose of a narcotics to someone who is seeking drugs. Right. Every drug allergy under the sun except for dilaudid fentanyl. Oh, and they need Zofran and Benadryl every 4 hours as well, which will prolong and increase the high you get, and then probably refusing every treatment that will actually help them get better. Their voice. Heavy past current users have this weird raspy voice and their cadence is all sorts of word salad weirdly fast. IDK. It's not 100, but I feel like I have yet to meet someone with that voice that hasn't been an addict at some point. Their liver function tests you have AL and AST. They are both elevated when you have liver damage. But if it's from alcohol, the AST will always be higher. If it's from other factors, the opposite is true. Usually, people who use hard drugs for a long time experience significant dental deterioration. My sister is a dentist and often pays attention to this when addicted young people come to her. I had a sister do math, and my wife worked for a law firm that had some clients come in high. They were always in denial even though they looked like skeletons. I read from a previous similar post, optometrists can tell by the powders deposited in the veins in your eye. The more build up, the more cut your drugs are. They've got a mysterious knack for disappearing just before urine tests, like they're auditioning for a magic act, abracadabra, and the pee cup is empty. They look older than their stated age. Heart failure in a younger person could be a sign. Liver cirrhosis Hep B or Hep C difficult stick. Generally alcoholics are somewhat likely to hide their true use, but significant drug users will tell me as I walk through door. Was a nurse, right as soon as you walk into their room. I swear not an addict don't have a drug problem. But their lab results tell me it's positive for cocaine or whatever the drug of choice is. Usually really good indicator. Their baby is so jittery. The tremors are sometimes mistaken for seizures, and also the baby is inconsolable. A real subtle hint. Their history says they were found at home unresponsive with an empty bottle of Imodium. Scars on thumbs, from pipe lighters when smoking crack. Also, front teeth rotting. Again, from crack use. Pharmacy super nice until they are told they can't be filled. Then they turn into a raging demon. It takes a long time to sedate them, and even horse doses don't do it. When the patient reports allergies to Toradol, Tylenol, Motrin, Tramadol, they're allergic to every analgesics except the narcotics they like. They know their good veins better than the healthcare professionals. Allergic to pain meds, so they can narrow down which ones they can get. When they Uber Eats alcohol into their room during a hospital stay, long sleeves and a jacket when it's 90 degrees out. I normally have a high pain tolerance ortho PA.